Welcome to a special presentation from the Rotary Clubs of Jonesboro and West Little Rock. I'm Gary Higgins, President of the Rotary Club of Jonesboro. Rotary's motto is service above self. One way we serve is through outreach and education. This forum is a great way to share information during this pandemic. I'd like to thank District Governor Mike Benich for his support of these COVID-19 updates. I'd also like to recognize the outstanding contributions by Hatton Weeks, our host and moderator. Hatton is the Vice President and General Manager of KAIT-TV and is a member of the Rotary Club of Jonesboro. We are fortunate that he shares his years of experience in news and media with Rotary. Thanks for your time, and please ask questions. We want this presentation to be interactive.
Hey there, my name is Doug Shackelford, and I am President of the Rotary Club of West Little Rock. Our club, just like all of the clubs around Rotary District 6150, are where neighbors and friends and problem solvers share ideas and join other leaders to take action to create lasting change. In our club, we are so fortunate to have Dr. Jennifer Dillaha as a member. Dr. Dillaha is the state epidemiologist with the Arkansas Department of Health. She is also our 2019-2020 West Little Rock Rotarian of the Year. Our state leaders continue to lean on her every day for expertise and guidance, especially during this unprecedented time of pandemic. We are privileged to have her in our club and for her willingness to share her knowledge with Rotarians and other civic organizations throughout Arkansas.
And good afternoon. My name is Hatton Weeks, member of the Rotary Club of Jonesboro. Thank you for joining us for this live presentation. A very important topic we're discussing today about the coronavirus vaccines and when it will be available to you. And we need your participation, not only to get vaccinated, but in today's discussion. After Dr. Dillaha goes through her presentation, we left plenty of time for your questions today. You can ask those questions either on the Facebook Live or YouTube chat windows. We're going to get to as many questions as we can today. We just ask that you keep the questions relevant to today's topic about vaccines. Now let's bring in Dr. Jennifer Dillaha with the Arkansas Department of Health. Dr. Dillaha, let's get vaccinated.
Well, thank you for having me today. I'm just really pleased to be able to provide you with an update. We've been doing a lot of work getting ready to distribute and COVID vaccines around the state. So I wanted to be able to update everybody so they would know what to expect. So let me go ahead and get started with my presentation. So today I'm going to talk about our plan for distributing vaccine and using it around Arkansas. So first of all, it won't be any surprise to us as Rotarians that vaccines have made a really incredible impact regarding the morbidity, which is really what we call the sickness. The illness is caused by a number of diseases. So in the 20th century, the annual morbidity for measles was over 530,000 cases. And with vaccinations, we have reduced that by more than 99%. We've also reduced the morbidity for pertussis, mumps, rubella. We've completely wiped out smallpox in the United States, almost wiped out diphtheria. And of course, near and dear to our heart as Rotarians, we have not had a single case of paralytic polio in the United States for a long time. So vaccines have the potential for having a tremendous impact on a number of diseases. So of course, we would like to have an impact on COVID-19, our current pandemic right now. So you can see in the middle here, we have well over 276,000 total cases of COVID-19 in Arkansas. And of course, these are just the cases that have been reported to us. We know there are many more out there that never get reported. Sadly, we've had a large number of hospitalizations, and that would include over 1,100 currently in the hospital, many on the ventilator. And this is also a distressing number because half of the people who go on the ventilator with COVID-19 don't make it. They pass away. And this is leads to an elevated number of deaths. So yesterday, on January 20th, we had over 55 deaths reported in Arkansas due to COVID-19. So there's a considerable amount of morbidity and mortality related to COVID-19, and we are thrilled to have not just one, but two highly effective and safe vaccines in Arkansas available to us. So it's the Arkansas Department of Health's role to, in a sense, coordinate and plan for the distribution of the COVID-19 vaccines in Arkansas. Our main goal with the distribution is to vaccinate as many people in Arkansas to markedly reduce the death and severe illness that COVID-19 causes. We also have a secondary goal, and that is by the time we get to the other side of this pandemic, we want to leave Arkansas's vaccination infrastructure for other vaccines. If we build that infrastructure for the pandemic, we want it to last so that it's stronger after the pandemic is over than it was before the pandemic began. So the health department's role is going to be kind of like a coordinating hub for ordering vaccine and distributing it around the state. We have to have plans in place for how healthcare providers will request the vaccine, how they'll receive it, and how they'll administer it. And we have a data system called WebIZ, which is the state immunization information system. Some people call it a immunization registry, that we have to manage for the ordering and reporting of the doses that are given around the state. You know, in the beginning of COVID-19, we developed a plan last fall. In the middle of October is when we submitted it to the CDC, but so much has changed since then that we asked the Arkansas National Guard team in logistics, operations, and communications to come and help us put our current plan down on paper so we could share it. And here is a link for people who would like to go to that updated plan. It was released last Friday evening, and we hope that it will make a good tool for communicating how we plan to address the vaccine distribution in Arkansas. There are certain principles that we want people to know about as we developed our distribution plans. One is that we want all counties in Arkansas to receive vaccine on a regular basis. We think this is really important for our equity, and I could have just as easily put a four-way test up here, because if there's anything that meets the Rotary four-way test, it's the vaccines. We also wanted to make sure that we didn't favor the metropolitan counties over the rural counties. And also, you know, we have counties with major hospitals in Arkansas, and some counties that don't have major hospitals, and some counties that don't have any hospital. And we wanted to make sure that those counties without the major hospitals had equal priority to vaccine than the ones compared to the ones that do have major hospitals. We're concerned that people know how to get vaccines and can book appointments and arrange or learn about when vaccines will be available to them. But we know that, you know, there are a lot of people in Arkansas that don't use smartphones. They don't have access to the internet, or they don't use it, and they struggle with reliable transportation. So we're going to have to make sure that all these people are included in our planning, and that we also take safety into consideration. These are new vaccines, and they require that after people are vaccinated, they must remain where they are and be observed for 15 to 30 minutes. And that changes your workflow. And, you know, we used to have drive-through flu clinics. We can't do that if someone's got to be observed. Sometimes some places have adapted by having a parking area and someone in the parking area to go around and observe all the cars in case people have an incident after they're vaccinated. We're mostly concerned about a severe allergic reaction. It's rare, but it's been noted to happen, and we want to make sure people receive attention if it does happen to them. And then we also have to think about how we're going to give the vaccines. we used to have these large scale flu vaccination events in every county, and people would line up and all get their flu shots. Well, right now we don't want people lining up to get the COVID vaccine shot, because that could actually help spread COVID-19 if people are present and have it. So we're trying to do a smaller scale vaccination venues, and a lot of those compared to a few large venues that could promote the spread of COVID-19. So right now we have 2 vaccines available in Arkansas, the Pfizer-BioNTech vaccine, and it's got some characteristics that affect how we can distribute it around the state. The minimum order right now that you can have shipped is close to 1,000 doses. And so there's lots of places that can't use 1,000 doses. So what do you do with all those doses? And it also requires that it has to be stored at minus 70 degrees. And most places don't have a minus 70 degree freezer. Some places have acquired them. So the way we're distributing this vaccine is we're using a hub and spoke model. We find we have places that do have a minus 70 freezer. They receive this shipment of vaccine, and then they're able to take doses from that initial shipment tray and transfer it to pharmacies in the community. And and once you take it out of the freezer and thaw it, you have 5 days to use it. So that goes to the pharmacies, so they have a chance to give those vaccine within the 5-day window. The Moderna vaccine is a little bit more flexible. It's got a minimum order of 100 doses. So you could send that to places that have smaller populations, don't need as many doses. It's also frozen, but it's at the usual temperatures that we freeze some vaccines, like the MMR or the measles, mumps, rubella vaccine or the chickenpox vaccine. They're all frozen, but at usual frozen temperatures, and a lot of places have those kinds of freezers. And so that, because of that, the Moderna vaccine can be shipped directly to a pharmacy or a clinic or a hospital. It doesn't have to be shipped somewhere and then the doses redistributed because you need a smaller amount. So what we've done is we've implemented hub and spoke in some places. So on this map, there's green counties, and those are the hub and spoke. So 1 or 2 locations in those counties receive a tray of Pfizer vaccine, and then they take doses from the tray and distribute it to pharmacies or other locations in those counties. And then the yellow ones are places where there are pharmacies that receive direct shipment of the Moderna vaccine. But if you look at the numbers of people in those counties, the green ones are about half of the population in Arkansas, and the yellow ones are about half the population, the other half of the population. So we've got them kind of half and half. So what we're doing now is trying to get the vaccine out as fast as we can get it, but we're not receiving many doses. We can look at it in 3 different ways: in phase 1, phase 2, and phase 3. We're in phase 1 where we have some doses, but the number of doses is limited. So we really have to prioritize who can receive those doses in order to be most effective in preventing illness and death. In addition, after we finish phase 1, then when a large number of doses are available and pretty much anyone who wants to get vaccinated can vaccinate it, that would be phase 2. And so we will complete our vaccination of the population then and move on to phase 3 when there might be a few people who still need to be vaccinated, but it becomes more of a routine vaccination, just like other vaccines that we have for our population. So we just finished. Phase 1 is divided into phase 1A, 1B, and 1C. And we just finished 1A, which was focused on healthcare workers and people who live in long-term care facilities. Healthcare workers, we started with hospitals because, as you may know, our hospitals are full of COVID patients, and we really need to make sure that we protect our hospital workers so we have somebody to take care of those patients who are in the hospital. We also want to protect our long-term care residents, they are the most vulnerable people to COVID-19. So we provided vaccine to them. The hospital workers got Pfizer and the long-term care residents got Moderna. And then once we finished vaccinating the hospital workers, we moved on to healthcare workers in the community. And they were people who don't work in hospitals and they don't work in a long-term care facility. They work in a number of different areas, such as primary care or urgent care or dental clinics or home health or pharmacies, lots of different places where healthcare workers work in the community. And we've done a pretty good job of reaching out and vaccinating just about any healthcare worker that wanted to be vaccinated. So we have now moved from 1A to 1B. And in 1B, it's a very large group, so we've had to prioritize the people who will be receiving vaccine, because even though we moved into this large group of 1B, the number of doses we are receiving in Arkansas has not gone up. So now we've moved to a much larger group, and we still have the same small amount of vaccine. So we're focusing on people who are age 70 and older. That's well over 336,000 Arkansans. These folks will be able to receive vaccine in community pharmacies or in vaccination clinics and medical that hospitals set up, or medical clinics where they may be patients. We hope to expand the number of locations in the future as the number of vaccines we receive in Arkansas increases. We're also prioritizing a central workforce, different sectors, and first we are prioritizing those who work in education. So that would include daycare, K through 12 school districts, as well as institutions of higher education. That's well over 132,000 Arkansans. And the way that will work is that the school district or the college and university will work with a local vaccination provider to make arrangements for their workers to be vaccinated. They will poll their workers and determine who wants to be vaccinated and make arrangements for the number of doses to be acquired. And then that local vaccinator will come on site and vaccinate them, or they could arrange a special clinic elsewhere for people to be vaccinated. But there's a lot more people in 1B that will be vaccinated later on after those in education are vaccinated. It includes food and agricultural workers, manufacturing facility, people who work in manufacturing facilities, food service, public transit, U.S. Postal Service correctional workers, and so forth. And then, of course, we have a graphic here. You have to have a graphic to explain things. So people like who are age 70 and older, they would likely go to a pharmacy or another provider of vaccine and make arrangements, an appointment, or get on a wait list. And then that group will let the health department know they need vaccines. The health department will order it for them and have it shipped to them. And then they, at that point, they'll get vaccinated. And then the Pfizer and the Moderna vaccines both need 2 doses. So when people get their first dose, they need to make an appointment for their second dose. For groups like workers that work in schools or some other place of employment in one of these high priority sectors, then that workplace or employer will work to determine how many people want to be vaccinated. They'll let the provider, either the local pharmacy or other organization that's providing vaccines, know how much vaccines doses they'll need. And that will be communicated to the health department and will place an order, and then they can schedule a time for vaccinations. One of the things that's frustrating is that everybody wants vaccine now, and we can't provide enough vaccines to everyone. So people need to make their plans and then set their date when they know the vaccine is on the way. A lot of places have set dates and couldn't get the vaccine and then had to cancel them, and that's very frustrating to people. We're also asking, and this will be helpful for Rotarians to know, that we want people to sign up with just one location to get vaccines. So, and they should sign up in the county that they reside. what we're finding is that some people want the vaccine so bad that they're calling all around the state trying to find a place where they can get vaccine and signing up at multiple locations. And that really confuses the local planning efforts, because then we don't really know how many doses are needed in that county if you have people from other counties registering in several counties. And then what happens is somebody, say, signs up for at 5 or 6 places to get vaccine thinking that will help them get it faster. Then that means there's 4 or 5 people who couldn't get on the list because it was all these slots were taken up by one person. So we're asking people to sign up or arrange for vaccination within their county, and then be patient and wait for the vaccine to be made available to them, because signing up in multiple places is not going to help them get vaccine sooner and really just confuses the planning efforts. So how long will it take us to get all the people in phase 1B vaccinated? Well, we think there's about 850,000 in 1B. So every week we get an allocation for the following week. So this week we got an allocation of 37,125 doses to give the first vaccine to someone to arrive next week. It's about half and half, about half for Pfizer, about 18,525, and half for Moderna was about 18,600. And that's really not very much vaccine. If you average it out over 75 counties, it's less than 500 doses per county. And that's not enough. So if we do not get an increase in the number of doses we receive every week, it's going to take us at least 16 weeks to work through this 850,000 Arkansans, assuming that 70% of them want to be vaccinated. So it's going to take us a while. People will need to be patient. It is our hope that in the near future, the number of doses made available to Arkansas and around the country will increase. But we have to plan as if it's not. But if it does, we're ready, because we have planned in such ways that we can scale up and increase the number of locations that have doses around the state. After 1B, we get to 1C. That will include people who are 65 and older, as well as people who are younger, 16 through 64, who have high-risk medical conditions. Medical clinics will hopefully be able to play an important role in vaccinating this group. We anticipate by this point we will have an increased number of doses. And also there will be additional essential workers in this group who need to be vaccinated. And so this is also a sizable group, and it will take us a while before we can get everyone vaccinated. After 1C, we'll move into phase 2. As I mentioned before, we're assuming at this point there will be vaccine doses available for just about anyone who wants to be vaccinated. We'll focus on ensuring access to vaccine for people who, for some reason, could not get vaccinated as part of phase 1. And if there's any particular populations that need special attention, we'll address it in phase 2. And then once we're done with phase 2, we'll move to phase 3. And by that time, we hope that there will actually be other vaccines available with their doses, so that people may have a choice at that point and it becomes more of a routine vaccination process. So we're doing pretty good in Arkansas so far with what we're doing. These are all the doses that the state of Arkansas Department of Health has received and distributed around the state. These are the number of doses given. This number includes some doses that are needed for the second vaccine. But we've given out over half of our doses, which compared to other states is actually pretty good. The New York Times runs a comparison. So in terms of the percent doses that have been used in the US, it's 46%. In Arkansas, it's 52%. And so we rank 13th in the country for how well we're doing in terms of getting our doses out there into people's arms. The other thing that's important to note is that we're making good headway in getting people their first dose. In the US, about 4.3% of the folks have gotten their first dose. In Arkansas, it's 4.8. So we rank 14th in the country. And then the most important part, though, is to make sure people get fully vaccinated. They get both their doses. So in the U.S., 0.7% have gotten both their doses. In Arkansas, 0.9%. And so we're tied for 9th place in the country. So I think we need to give ourselves a hand. This is definitely a challenging time. We don't have enough vaccine for everyone, but I think if people are patient, we will be able to get vaccine for just about everyone who wants it. In the meantime, we're still going to need to have, carry on with those things that we know work to reduce the spread of COVID-19. We all need to keep wearing our masks, washing our hands, maintaining our social distance, because we need to do everything right now to continue to reduce the spread of COVID-19 in our state. And so this is a 7-day rolling average of all the cases reported in Arkansas. So you can see we've had a really steep increase at the beginning of the year. But look at this. We are coming down. We are making really good progress. We need to keep this up. We're still very high compared to where we were in the past. But with wearing face masks, social distancing, washing our hands, avoiding crowds, avoiding non-essential activities, and then waiting our turn, and when it's our turn getting vaccinated, I think that we can get on the other side of this pandemic sooner than later. And of course, for every case, there's a number of cases, then, there's people who's going to end up in the hospital. And right now we have a lot of people in the hospital. We're coming down and we want to keep that up, but there are way too many people who are severely ill with this illness. And we want to make sure that no one suffers this illness if we can avoid it. So we all need to do our part to prevent the spread. So I'm going to stop now and see if there's questions and see if there are other issues related to COVID-19 vaccines that people would like to talk about.
Beginning to get some questions in on the Facebook and YouTube chat windows. If you have a question, this is a live presentation. Just ask the question in the chat window. We're going to get to as many of those questions dealing with vaccines today as we can. And in a minute, I want to do a quick Q&A with Dr. Dillaha, the state infectious disease specialist, the epidemiologist for the state of Arkansas. Some myth busting on the COVID-19 vaccines. But first, we're going to take a couple of questions. And I want to start with Tracy Ritchie, who asks, will the other groups in 1B follow the same process as the school groups? I'm not sure I'm following her question, but do you think you can answer that one?
Yeah. So say a manufacturing company, and they would be eligible in 1B. So we would want that company to make arrangements for vaccination of their employees. We think that would be much more efficient and effective in getting them vaccine than all of their employees trying to find a place to get vaccinated. Plus, there are a lot of companies that have an occupational health department, and potentially they could be provided with vaccine and vaccinate their own employees. So the idea is for them to work with their local vaccination providers. We're encouraging all those that are providing vaccines in counties to collaborate with one another and coordinate so that we can be most efficient in vaccinating the people in those counties. And so it really is working pretty well in some counties. People are on the same page. They're working not to undo the planning of other groups, but if they know what each other's doing, they can make sure everyone gets covered and no one gets left out.
And just reading through a number of questions here, and I believe that Tim Rand, looking for his question here. Tim, I hope you and your family doing well. Tim asks, when do you think the 65, 69-year-olds will be realistically eligible in Arkansas? I know you put April, but if it's really going to depend on the supply of the vaccine, is that right?
Mm-hmm. So we've been hoping April. We were thinking that the number of doses we would be receiving in Arkansas would go up in the near future. So we have to plan like it's not going to. So I think it would be May potentially before they get vaccinated, which I think is too long. But we do have another vaccine on the horizon that may finish its clinical trials. And if it's approved by, or what we say, authorized by the FDA for use, then that will help bring additional doses. In the meantime, the federal government is working with the current manufacturers to help them with their processes. Some of the limiting factors are the raw materials, so they're working to contract with companies that can produce the raw materials. So there's a lot of things in play, but I'm thinking that April may be optimistic if the number of doses do not increase.
And District Governor Mike Bennett's asking, if you live in Arkansas but you work in Tennessee, can you still get on the 1B list?
That's a very good question, and I don't know that we've really discussed that. You know, some people in Arkansas are going to other states to get vaccinated, and we are not really wanting to vaccinate residents from other states. Unless they work in Arkansas, because that's a protection for Arkansas workers. So we haven't actually looked at it the other way around. I would think that that would be a possibility, that they could be vaccinated in Arkansas, but we haven't really determined a firm policy on that.
Let's see. Mr. Andrews here asking, when might church workers become eligible?
So we received that question a lot, and right now they are not technically part of 1B or 1C. So if they do not fit in the age or the category for those who have chronic illness, then it would be in phase 2.
Dr. Jennifer Dillaha, the epidemiologist with the Arkansas Department of Health, joining us this afternoon. Fellow Rotarian, taking your questions about the COVID-19 vaccine. If you have a question, just ask in the Facebook Live or YouTube chat window. And continuing on here with some additional questions. Nancy asking, my husband and daughter both are on their way to being fully vaccinated. How much of a threat would I be to them if I got COVID? So
if they are fully vaccinated, then they would be likely protected from you. 95% of the people in the study groups during the phase 3 trials were completely prevented from getting COVID-19. The rest 5% got mild cases. No one got severe disease. So the vaccines were 100% effective in preventing severe disease. Even so, I do not know that I want to test it. So if you got COVID-19, you would need to isolate. But I think you could take some comfort in knowing that it would be unlikely if they got infected, they would have severe disease.
So better safe than sorry. In that
exactly.
case.
And, you know, not everybody responds robustly to the vaccine. So, you know, especially as we get older, our immunity wanes. Even so, these vaccines have shown pretty good efficacy in older adults, more than many other vaccines. So that's hopeful, but I wouldn't want to test it, you know.
Understood. Beginning to get some questions on underlying conditions. And I'll just start with this one from Scott Trotter asking, does hypertension qualify as an underlying medical condition?
Yes, hypertension is one of the biggest risk factors for, or most common risk factors for severe disease.
And Marty Allen here asking, how are people under 65 with underlying conditions prioritized within various groups, or are they not prioritized when signing up for the vaccine? Asking there, is there going to be will hypertension be placed higher than another underlying condition?
Well, when it comes to a work group, you can't really prioritize them because the employers this is HIPAA protected information. You don't want to necessarily be revealing to your employer what your health conditions are. Legally, they're not, they can't require you to tell them. So that's one of the issues. So if it'll be all the employees. But within the group with chronic conditions, I do not think we will be able to prioritize people, because a lot of people have more than one condition, and I cannot fathom a way to sort that out. So I think it will be anyone with a list, within a certain list of high-risk conditions.
Former District Governor John Deacon asking, do you have any statistics on what the percentage of those eligible receiving, on those who are receiving or requesting the vaccine?
So we do have some information in Arkansas about healthcare workers, and it varies with the type of work they do and their location or their setting of their work. And we're finding this interesting phenomenon. So in some facilities, it's like a lot of people want the vaccine or few people want the vaccine. So I'm hearing oftentimes about 30% of the people are declining the vaccine, but it does vary. And then what has happened is some healthcare workers are holding back to see how other people in their workplace do once they get vaccinated. I think over time, the vaccine will, in a sense, sell itself. But I think, one of the challenges is people making informed decisions about being vaccinated. There's so much misinformation out there, and people do not have the skills they need to sort through what is good information and what is misinformation. So it's a struggle for people to make an informed decision. But I think that over time, the percentage of people who get vaccinated will go up.
Dr. Jennifer Dillaha with the Arkansas Department of Health taking your questions about vaccines, coronavirus vaccine. We're going to do some myth busting here in a minute, but we're getting a lot of comments, and which is fantastic. We need this to be, we need your questions. Another one here, how do we assure that people who receive the first dose will be eligible to get their second dose at the appropriate time? And I assume that's been worked out, but can you go through that a little bit?
Sure. So for the Pfizer vaccine, the second dose is needed at least 21 days after the first dose. So you don't have an outer limit. It just can't be before that 21 days. And the Moderna, the limit is 28 days. So a minimum of 28 days between the first and second dose. And after that, it doesn't matter how many days, but we want people to get it as close to 28 days as possible, because we want people to be fully vaccinated as soon as possible. So what we're doing is, for people who receive, the vaccine providers, they get a shipment of first doses, and we want them to give all of those doses out, get as many people vaccinated as possible, as quickly as possible. And then in 2 weeks, we send them a shipment of second doses for those people who got vaccinated. So they have those doses on hand before that 21 days or that 28 days is up. So they hold on to those doses and wait and make appointments for those people to come in and get their doses. So if the system stays the way it is right now, there should be no problem in people getting their second doses. Some places have, like in the UK, they've just given everybody their first dose, and then they'll get the second dose as they can. There's really not good evidence to say that's the most effective way to do it. And I am not in favor of doing that. I think our best scientific evidence is to get people with fully vaccinated as quickly as possible. And the more people we have fully vaccinated, the better off we'll be in terms of turning this epidemic around and getting on the other side of it.
Going to take a couple of more questions here. Audrey Gwynn with the Rotary Club of Jonesboro. Good to hear from you, Audrey. If you've had COVID, is there a delay on when you can get the vaccine? Does the health department keep up with that?
Okay. So anyone who's been diagnosed with COVID can get vaccinated as long as they're not acutely ill and they're no longer in isolation. So you do not need to wait a certain period of time as long as you meet those two criteria. Now, it's thought that most people who have had COVID will have enough immunity to protect them from reinfection for about 90 days. Some people, it may be longer. Other people, it may be shorter. So some people have, when it's their turn to get vaccinated, have delayed vaccination because they wanted other people to be able to have those few doses available, knowing that they would be protected for a while other people would not. And that's totally up to the person who wants to be vaccinated. But I think that there's not enough vaccine out there. And I think that if people, it's their turn to get vaccinated, and even if they've had COVID-19, I would go ahead and just get vaccinated, because you don't know when your next turn will going to be. And you don't really know how long the immunity you gained from having COVID-19 natural disease is really going to protect you for.
Going to take a couple more questions here before we do a little myth busting on coronavirus vaccines. And Allie brings up a really interesting question here. Are there recommendations regarding where college students studying out of state should be vaccinated?
Well, right now, there are no recommendations for college students to get vaccinated. They would be in phase 2. So I do not think that they would be, there would be any state for them to get vaccinated right now. However, if someone is in an eligible group and they can get vaccinated, I think they should get vaccinated wherever they can. I don't really want people from Texas or Missouri or Tennessee coming to Arkansas and using Arkansas's allocation. But other people from Arkansas have gone to other states and gotten vaccinated. And, if the other states want to vaccinate our Kansas, it's okay with me. I won't stop them. But I would really rather reserve our vaccine for people who are eligible to be vaccinated in Arkansas.
And last question before we go into a little myth busting here. Debbie asking, did I understand you to say that once you've had both doses, you're protected immediately?
Actually, it takes 2 weeks or more to develop the optimal immunity after the second dose.
And we're going to do a little vaccine myth busting here. And so first myth, COVID-19 vaccine is not safe because it was rapidly developed and tested.
So let me just state that the 2 vaccines that were authorized by the FDA have met the same safety and efficacy criteria as any other vaccine. The reason we have been able to develop these vaccines so quickly is really there's multiple things going on. One is we already knew about the spike protein on the coronavirus that causes COVID-19 as being the target we wanted to go after in developing a vaccine. And the reason we knew this, because a lot of work on vaccines for SARS that occurred in early 2000s had been done. And there's another related disease called MERS, which is Middle Eastern Respiratory Syndrome. Work had already been done on those vaccines, so they could use that information to identify quickly identify the spike protein on the coronavirus that causes COVID-19 as the identity that's needed, or the target that's needed. The other thing that's really important is that the RNA, these 2 vaccines are what we call nucleic acid vaccines. And in order to make these vaccines, all you need to know is the genetic sequence of the protein that you're interested in. So when the Chinese published the genetic sequence of the novel coronavirus in China on the internet, they were able to take that sequence and have a vaccine ready for preclinical testing the next day. All they needed was that information. And then the other thing that's important is to know that the U.S. government has provided just abundant funding for the development of the vaccines. So usually the vaccines go through phase 1, phase 2, and phase 3 clinical trials in sequence, because you would never go to phase 2 if you hadn't shown that phase 1 was successful. And you wouldn't move to phase 3 unless you had shown that phase 2 was successful. So with a lot of funding available, you didn't have that financial risk. So they could actually, instead of running them sequentially, they could overlap them and do them concurrently. And so that enabled them to start enrolling people in phase 2 before they had completed phase 1. And they could combine phase 2 and 3, which are basically efficacy. Phase 2, you're using a small population to see if the vaccine really works. And so they could enroll lots more people in phase 3 because they could handle the financial risk. And the other thing the federal government did was they funded the manufacturers to scale up and produce millions of doses of the vaccine before it was ever authorized by the FDA for use. Under ordinary circumstances, no pharmaceutical company in their right mind would ever make millions of doses before it was approved by the FDA for use. But we did that as a calculated risk, and it turned out to be beneficial. The other thing is that the FDA reviews all the data themselves, and to make that go faster, they divided their staff into shifts and had them running shifts 24 hours a day, 7 days a week, in order to get ready for the review of the data in a timely way.
And you know, because you have this vaccine is manufactured, it's completely new technology from the way we have vaccinated people in the past, and with that come other myths. So another one is, you know, the myth that coronavirus vaccines cause infertility.
I don't know where that comes from. There is no scientific evidence that does it, and it's not even biologically probable that it could do that. It's just nonsense. I don't know how to refute that. It's just nonsense.
And because this is altering or it's attacking the mRNA of the virus, there's a myth that the vaccine will alter our DNA. Do you want to go into that a little bit?
So whenever a virus infects a cell, it gives the cell its genetic material, and the cell makes proteins to replicate the virus. So what we've done with the mRNA vaccines is we just give it the genetic material for that one protein. mRNA makes the template or the instructions for making the protein, and that takes place in the part of the cell that's called the cytoplasm. In order to change DNA, it has to go into the nucleus, but the mRNA cannot go in the nucleus, and it's unstable, so it breaks down, and it doesn't stay around very long. And so it just can't do that. If mRNA could alter DNA, then our cells would be altering themselves because they have all kinds of mRNA in them. It's just kind of pseudoscience nonsense.
Understand. Dr. Jennifer Dillaha with the Arkansas Department of Health, and we're getting a few questions here that I want to wrap on. And just going back to the question of when can I get vaccinated? Den Rogers here asking, is there a list of phone numbers for vaccination sites? I guess the best question is, if I am in group 1B or 1C and it's my turn, where do I go? Do I call the local pharmacy, my local doctor, the health department? Where's the best place to go?
So we have a list of the pharmacies that are participating in 1B right now on the health department's website. The health department's website is healthy.arkansas.gov. And so you can go there and find it in your county. We're asking you to identify the pharmacy that's convenient to you in your county where you reside. We're asking people not to call around the state and get on multiple lists.
And Gary Stoops asking is, are you able to share the age breakdown of death statistics?
Yes. So if you go to the health department's website,
And by the way, we were just putting that link up.
yeah. You go, there's a banner at the top about COVID information. You click on it, and I don't know if I can, I might be able to go to it and show it to you. Let me see here.
Can you share what age group are you seeing the most deaths from COVID in the state?
It's the older age groups. It's the 65 and older. And it's about 70 or 80% of the deaths.
My goodness.
So, so let me see if I can show you where to find it. All right. So can you see that, Google? So you go to the health department's website, which is this one. That's the main page. You click on this information about COVID, and you go down, you scroll down. Oh, they changed the website. So let me go back to well, I'm sorry, now I can't find it. We had a
Will this your presentation earlier, will it be available somewhere to be shared? Someone was asking earlier that they would like to share that in their workplace.
Yes. So also today I gave public health grand rounds with the similar information, but a lot more detail. And it's also going to be recorded on the health department's website. So I found what I was looking for. So if you click on this button, and it's the general information website on COVID-19, not the vaccination one. And you click on this, it'll bring up data about the health, the statistics about COVID. And you look on this tab down here with deaths, and you can see that this is the 65 and older age group, and it is shows that it's over 80% of the deaths. So
Sobering information there that we're going to end on today. This is a deadly disease. It's spreading, and but a vaccine is here, and it is getting rolled out. And so anyway, there is some light at the end of the tunnel.
Yeah.
Dr. Jennifer Dillaha with the Arkansas Department of Health, thank you for joining us this afternoon.
thank you for having me. I really appreciate you and all the Rotarians out there.
Well, we appreciate you for joining us and answering our questions and everything that you do for Arkansans.
Thank you.
And before we go, if you have a topic for a future conversation with Dr. Jennifer Dillaha or another expert, please let us know. We're looking to use this platform again in the future. This has been a special presentation by the Rotary Clubs of Jonesboro and West Little Rock. Thank you for joining us.